Lymphoma is a group of blood cell tumors that develop from lymphocytes. It is sometimes used to refer to just the cancerous ones rather than all tumors. Symptoms may include enlarged lymph nodes that are not generally painful, fevers, sweats, itchiness, weight loss and feeling tired among others. The sweats are most common at night. There are two main types, Hodgkin lymphoma and non-Hodgkin lymphoma, with two others, multiple myeloma and immunoproliferative diseases, also included by the World Health Organization within the category. Non-Hodgkin lymphoma makes up about 90% of cases and includes a large number of subtypes. Lymphomas are part of the broader group of neoplasms called tumors of the hematopoietic and lymphoid tissues. Risk factors for HL include infection with Epstein-Barr virus and having other in the family with the disease. Risk factors for NHL include autoimmune diseases, HIV/AIDS, infection with human T lymphotropic virus, eating a large amount of meat and fat, as well as immunosuppressant medications and some pesticides. They are usually diagnosed by blood, urine, or bone marrow testing. A biopsy of a lymph node may also be useful. Medical imaging then may be done to determine if and where the cancer has spread. This spread can occur to many other organs including lungs, liver, and brain. Treatment may involve some combination of chemotherapy, radiation therapy, targeted therapy and surgery. In NHL the blood may become so thick with protein that a procedure called plasmapheresis is needed. Watchful waiting may be appropriate for certain types. Some types are curable. The overall 5-year survival rate in the United States for HL is 85% while that for NHL is 69%. Lymphomas developed in 566,000 people in 2012 and caused 305,000 deaths. They make up 3 to 4% of all cancers, making them as a group the 7th most common form. In children they are the 3rd most common cancer. They occur more often in the developed world than the developing world. Signs and symptoms. Lymphoma presents with certain non-specific symptoms. If symptoms are persistent, lymphoma needs to be excluded medically. Lymphadenopathy or swelling of lymph nodes it is the primary presentation in lymphoma. B symptoms can be associated with both Hodgkin's lymphoma and non-Hodgkin's lymphoma. They consist of fever, night sweats, weight loss. Other symptoms are loss of appetite or anorexia, fatigue, respiratory distress or dyspnea, itching. Diagnosis. Lymphoma is definitively diagnosed by a lymph node biopsy, meaning a partial or total excision of a lymph node that is then examined under the microscope. This examination reveals histopathological features that may indicate lymphoma. After lymphoma is diagnosed, a variety of tests may be carried out to look for specific features characteristic of different types of lymphoma. These include immunophenotyping, flow cytometry, FISH testing. Several classification systems have existed for lymphoma. These systems use histological findings and other findings to divide lymphoma into different categories. The classification of lymphoma can affect treatment and prognosis. Classification systems generally classify lymphoma according to whether or not it is a Hodgkin lymphoma, whether the cell that is replicating is a T cell or B cell, the site that the cell arises from. Hodgkin lymphoma. Hodgkin lymphoma is one of the best-known types of lymphoma, and differs from other forms of lymphoma in its prognosis and several pathological characteristics. A division into Hodgkin and non-Hodgkin lymphomas is used in several formal classification systems. A Hodgkin lymphoma is marked by the presence of a type of cell called the Reed-Sternberg cell. WHO classification. The current accepted definition is the WHO classification, published in 2001 and updated in 2008, is the latest classification of lymphoma and is based upon the foundations laid within the revised European American Lymphoma classification. This system attempts to group lymphomas by cell type and defining phenotypic, molecular or cytogenetic characteristics. There are 3 large groups, the B cell, T cell, and natural killer cell tumors. Other less common groups are also recognized. Hodgkin lymphoma, although considered separately within the World Health Organization classifications, is now recognized as being a tumor of, albeit markedly abnormal, lymphocytes of mature B-cell lineage. Subtypes. Working formulation. First proposed in 1982, the working formulation was a classification of non-Hodgkin lymphoma. It excluded the Hodgkin lymphomas and divided the remaining lymphomas into 4 grades related to prognosis, with some further subdivisions based on the size and shape of affected cells. This purely histological classification included no information about cell surface markers, or genetics, and it made no distinction between T-cell lymphomas or B-cell lymphomas. It was widely accepted at the time of its publication but is now obsolete. It is still used by some cancer agencies for compilation of lymphoma statistics and historical rate comparisons. Other, real. In the mid-1990s, the revised European American lymphoma classification attempted to apply immunophenotypic and genetic features in identifying distinct clinicopathologic entities among all the lymphomas except Hodgkin's lymphoma. ICD-0, ICD-10, subtypes. There are many forms of lymphoma. Some forms of lymphoma are categorized as indolent, compatible with a long life even without treatment, whereas other forms are aggressive, causing rapid deterioration and death. However, most of the aggressive lymphomas respond well to treatment and are curable. The prognosis therefore depends on the correct diagnosis and classification of the disease, which is established after examination of a biopsy by a pathologist. Staging. After a diagnosis and before treatment, a cancer is staged. This refers to deducing how far the cancer has spread, in local tissue into other sites. Staging is reported as a grade between I and IV. Staging is carried out because the stage of a cancer impacts its prognosis in treatment. The Ann Arbor staging system is routinely used for staging of both HL and NHL. In this staging system, I represents a localized disease contained within a lymph node, 2 the presence of lymphoma in 2 or more lymph nodes, 3 spread of the lymphoma to both sides of the diaphragm, and 4 to tissue outside a lymph node. A CT scan or PET scan are imaging modalities used to stage a cancer. Treatment, prognosis and treatment is different for HL and between all the different forms of NHL, and also depends on the grade of tumor, referring to how quickly a cancer replicates. Paradoxically, high-grade lymphomas are more readily treated and have better prognoses. A well-known example of a high-grade tumor is that of Burkitt's lymphoma, which is a high-grade tumor that has been known to double within days, but is readily treated. Low-grade lymphomas. Many low-grade lymphomas remain indolent for many years. Treatment of the non-symptomatic patient is often avoided. In these forms of lymphoma, watchful waiting is often the initial course of action. This is carried out because the harms and risks of treatment outweigh the benefits. If a low-grade lymphoma is becoming symptomatic, radiotherapy or chemotherapy are the treatments of choice. Although they do not cure the lymphoma, they can alleviate the symptoms, particularly painful lymphadenopathy. Patients with these types of lymphoma can live near normal lifespans, but the disease is incurable. High-grade lymphomas, treatment of some other, more aggressive, forms of lymphoma can result in a cure in the majority of cases, but the prognosis for patients with a poor response to therapy is worse. Treatment for these types of lymphoma typically consists of aggressive chemotherapy, including the CHOP or R-CHOP regimen. Hodgkin lymphoma typically is treated with radiotherapy alone, as long as it is localized. Advanced Hodgkin disease requires systemic chemotherapy, sometimes combined with radiotherapy. Chemotherapy used includes the ABVD regimen. Prognosis, epidemiology. Lymphoma is the most common form of hematological malignancy, or blood cancer, in the developed world. Taken together, lymphomas represent 5.3% of all cancers in the United States and 55.6% of all blood cancers. According to the U.S. National Institutes of Health, lymphomas account for about 5% of all cases of cancer in the United States, and Hodgkin's lymphoma in particular accounts for less than 1% of all cases of cancer in the United States. Because the whole system is part of the body's immune system, patients with a weakened immune system such as from HIV infection or from certain drugs or medication also have a higher incidence of lymphoma. History: Thomas Hodgkin published the first description of lymphoma in 1832, specifically of the form named after him, Hodgkin's lymphoma. Since then, many other forms of lymphoma have been described, grouped under several proposed classifications. The 1982 working formulation became very popular. It introduced the category non-Hodgkin lymphoma, divided into 16 diseases. However, because these lymphomas have little in common with each other, the NHL label is of limited usefulness for doctors or patients and is slowly being abandoned. The latest classification by the WHO lists 70 forms of lymphoma divided into 4 broad groups. As an alternative to the American Lakes-Butler classification, in the early 1970s, Karl Lennart of Kiel, Germany, proposed a new system of classifying lymphomas based on cellular morphology and their relationship to cells of the normal peripheral lymphoid system. Research directions: significant research into the causes, prevalence, diagnosis, treatment, and prognosis of lymphoma is being performed. Hundreds of clinical trials are being planned or conducted at any given time. Studies may focus on effective means of treatment, better ways of treating the disease, improving the quality of life for patients, or appropriate care in remission or after cures. In general, there are 2 types of lymphoma research: clinical or translational research and basic research. Clinical translational research focuses on studying the disease in a defined and generally immediately patient-applicable way, such as testing a new drug in patients. By contrast, basic science research studies the disease process at a distance, such as seeing whether a suspected carcinogen can cause healthy cells to turn into lymphoma cells in the laboratory or how the DNA changes inside lymphoma cells as the disease progresses. The results from basic research studies are generally less immediately useful to patients with the disease but can improve scientists' understanding of lymphoma and form the foundation for future, more effective treatments. Other animals. For a discussion of lymphoma in animals other than humans, see the above link. References. External links: Lymphoma at DMOZ.